Good evening, everyone, and welcome to Pull Up with Limbs and Things. My name is Dr. Chanel James, and I am the owner of Limbs and Things, mobile and telehealth physical therapy practice. On Pull Up with Limbs and Things tonight, we're talking about the best of aging adults. So last month in May, Limbs and Things turned 5. How ironic that it was during the month of Older Americans Month. And now this month, June, is about men's health. So I'll do like a combination. So tonight, one of the best things about aging adults is they have to overcome fear. A lot of us have to overcome fear, but in more of a risk-taking sense. Um, Older adults don't have to overcome that fear in their everyday tasks. So building confidence is one of the things that is a challenge to do and one that we really have to work on immediately in physical therapy. So, quick patient story. I have a gentleman, former or retired military, and he was very much a active gentleman. Has had multiple back surgeries, multiple hospitalizations for lung issues and breathing issues, and so now he finds it hard to do most tasks, just in getting in and out of the bed, in standing, all of those things. And so we have worked to try to get him back to being able to stand independently, get him to transfer independently, all of those things. However, we've had a couple of setbacks. However, even with those setbacks, we've still been trying to build his confidence to reduce some of the fear he has. Because a lot of times it's not just can a person do the task, but is it not cognitively, but is it within them to be as confident in doing that task? And so one thing he said was, you know what? I did that. Let me do it by myself. I'm getting confident. My confidence is back. For anyone to say that, that's like the best thing a physical therapist can hear, especially when you're working with people in their own home environment and they have been through multiple bouts of physical therapy and they're having this next go at it, hoping that it's the best go. And so to hear someone say that they are improving their confidence, that's the best thing a therapist wants to hear. So building confidence is super important because it helps to reduce some of that fear. The fear of falling is great, but it's even greater in those who have their health to be declining and those who are getting older. All right. Another one is adjusting, and we have to adjust together. A lot of people think that people get old and they're just accustomed to being old, but it's a gradual thing. It's just like when you notice that you have like gray hair showing up in your head. It's a gradual process of seeing your hair turn from your original color to being gray. And so that's what kind of has to happen with them. So people, they live in a certain house that they have purchased in their younger ages when they are able to go up and down all these steps, and now they may need a stair lift. Or they have purchased this home and now they need to adjust it so that they now have a first floor bedroom or a first floor place where they can make a bedroom. Even some people, a lot of us like to decorate with rugs and throw rugs. And then we have to come to an agreement that we're going to use some double-sided tape on those rugs so they don't slide because we're not picking up our feet as much as we should. And as a result, we tend to develop these areas where we can possibly have ourselves fall because we've got trip hazards everywhere. So in your bathroom, in your kitchen, in your entryway to your home, you just want to make sure those things are fully tacked to the ground for your safety. And those of us who have pets, especially animals that roam around in your house, it is so important to teach safety with those pets and animals because there are so many people who are continuing to age with them. And even though those animals are getting older just like them, they may be slowing down and not see that toy that the dog threw out in their path. The lights may not be as bright anymore. And so it makes it a little bit more challenging to navigate those paths that you're familiar with going through your home because now it has a different object in the way. With that gentleman we were talking earlier, adjusting together, like raising the bed. So one of the things we did to increase his confidence is he has a hospital bed. And so increasing the height of that bed so that he would be able to stand. And then he got to the point where he was actually able to do it and we watched him succeed. But there are so many times when we get to the height and we're able to get the success there that we then have to gradually bring it down so that that success will continue at a lower height, because we can't all stand from what I like to call as we up in heaven now. We just got to come on back down to earth. So there are some ways that you can build confidence with people, and that's one of them. Okay, and then forgetfulness. It's a normal thing. As we get older, we tend to be a little bit more forgetful. My mother likes to say that the person who um, came to the board meeting, they left and went out the room. And so sometimes when you're thinking about that thought, the person or the thing that's in your head has just left the room. And so it may not come back in the same time frame that somebody is in front of you. And so forgetting sometimes is a part of practice, it's a part of life. And so we have to improve that ability. And as we grow with technology, one of the ways we do that is trying to give our older adults the latest device, whether we're giving them a smartphone or a watch, a smart watch, so that they can keep time and be able to catch our phone calls without having to go run for their phone, all of those different things. But it's so important when you give them something that you teach them how to use it. So I find myself doing a lot of education on making sure people know that this watch can also be a heart rate monitor. This watch you can ask to your phone. This watch you can talk your text. This watch you can do a lot of different things that help you to remember, okay, I should stand, I should sit, I should look at how active I'm being throughout the day with a little activity monitor on it. You can also look at your calendar and see when you have a PT appointment coming through. One of my patients today, I was showing her how to do that because she forgot our appointment. But then you have to be able to also revert back into calling people as opposed to texting them, or texting them and calling them as well, and then reminding them on that day of too that you're coming to see them. And so teaching someone how to swipe a text, especially those people who have difficulty with their dexterity as they get older. Those finger motions may be a little hard. Their fingers are bigger than the letters, enlarging the print. There's so many things that we end up educating about so that we can keep aging well with the changes in technology. And then another thing we want to do is making sure that we engage all of our senses. So we've got 5 of them, right? But it's important that we use them all in therapy. It's just like when you were in school and they were teaching you, if you want to learn something, you have to use or engage at least 2 or 3 of your senses in order for it to be stuck in your brain. So whether we do it kinesthetically with moving, and then we talk about it so that it's in your head. I do a lot of mental rehearsal, especially with those who have decreased cognition or dementia or anything like that. I'm talking to you multiple times about the same thing. I probably sound like a broken record, just trying to make sure that, yes, you're hearing what I'm asking you to do. Okay, now we have to do it. And then we do it together so that we get the whole benefit of knowing, doing, and being able to repeat it. So one way in using our touch sense or feeling is a person always gets a pat or a hug. They can expect that in every session. There's something about touch that helps people to do their best, feel like they're being seen, feel like somebody actually cares. That emotional connection and being able to touch somebody goes a long way. Then hearing now, I'm listening for how well you're breathing, if your feet are sliding on the floor. And another thing I'm listening for is as we get older, we get all these crunchy sounds, or we get these sounds that go along with a little aching. It happens a little more frequently when it's raining outside or the weather isn't good. And so those things we tend to listen for. But I'm also listening to hear how you're sounding about things. You can hear if someone is sad. You can hear if someone is excited about something. You can also hear me giving advice or typing on my computer, all of those different things. But the physical hearing, so being able to touch someone, listening to them, but also seeing. We use our sight to see progress. We look at the changes in your movement. We're also trying to see A lot of people want to know how old I am. I think that is so funny that people always looking at me like, oh, I'm judging. Let me see how many gray hairs you have. That's how old I can tell you are. And I'm like, oh, is that an indicator? I mean, there's some people that premature gray early. But it's always interesting to see someone's progress as well as all of the different factors that determine their safety. So whether someone is watching me enter or leave their house, or I'm watching them do the same, just as practice. So seeing, hearing, and touching, those are three. Taste, now I'm not doing that. I try real hard not to eat or drink at anybody's house. It's just a professional thing, but I'm always asked, do you want something to eat or do you want to take some water with you? Um, those are always gestures I appreciate. But even there are some people, especially those when I'm working with your face and you have Bell's palsy or you have any neck issues, I want to see how well you swallow. I want to see how well you chew. So I might give you some gum or something like that. Um, those are things that are really important, especially in the TMJ issues too. Opening your mouth, opening your jaw, listening and looking to see if you're dizzy or any of those things. So it's four of those senses we've gone over now. Okay. The other one is smell. So yes, a lot of people tend to ask, do you go into homes where people are hoarding? Yeah, I've been in one or two of those. I try to limit them. However, you can't always. Um, so yeah, there are odors that you may associate. There are odors that you need to be aware of, like red flags in terms of like infections. Those have specific odors. Continence issues, all of those things help determine, if you need to refer somebody out or if there's something more serious going on or if the person is just not aware. And that could happen. And then there's always those smells of coming into someone's home and they're cooking, or coming into someone's home and they are cleaning, all of those different things, engaging those senses. And so you can engage, if you can engage at least three, then that's a great thing for the person to be able to take back with them once you leave the session. And so I try to engage at least three of them in every session. So building confidence, super important, so that we reduce the fear that the person has. Adjusting together, whether we are changing the person being able to walk with no device to walking with the device, and trying to abate some of our pride in terms of not wanting to be seen with the device or thinking that you're weaker as a result. And then engaging the senses. We want to look at all five, but trying to engage at least three. So those are some of the things that I have found that are the best things in helping aging adults to continue to thrive and do their very best. Again, this is Pull Up with Limbs and Things with Dr. Chanel James. If you have a comment or a question and you want to throw it in the chat, please do. I'll answer them. And then stay tuned for July's Pull Up with Limbs and Things. It'll be coming every first Saturday at 6 p.m. right here. If you are interested in having physical therapy and getting more of these things up close and personal one-on-one, you can contact LimbsNThings at LimbsNThings.com, or you can give us a call at 202-643-2636. Always, Limbs and Things is to help you move from I can't to I can. Have a good night.